from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about bystander response to traumatic injuries which cause bleeding. Our guest today is a nurse and trauma injury prevention coordinator at Sarasota Memorial, Casey Howell. Casey, thank you so much for joining us again.
Oh, thanks for having me.
It seems self-explanatory, but you teach a class called Stop the Bleed.
Mm-hmm.
What does Stop the Bleed mean?
It is pretty self-explanatory. This one is pretty on the nose. So it is bleeding control techniques to deploy at the moment or as soon as possible after a traumatic injury that's resulting in excessive blood loss.
Why is it so important that people get the appropriate Stop the Bleed training?
So when we experience a severe traumatic injury, we have the potential to lose blood faster than even medical intervention can pump it back in sometimes. So when we're talking about being out and about in the community, about your everyday business in your backyard, in your workshop, at the mall, that means that time period with which I could lose a critical amount of blood loss is faster than the fastest EMS response time sometimes. So having the ability to be confident and empowered to react and respond and do something purposeful to try to limit that or stop that blood loss so that we can get emergency services to get those people to the hospital where they can get the intervention they need.
Who should get Stop the Bleed training?
Everyone.
And why?
The better question is who shouldn't, right? Maybe if you're too young, to physically do kids, but older children, teens, adults, you never know, right? That's the point of an unexpected traumatic accident. Some accidents can be prevented or avoided with safety measures, but there are always those that can't. And it's not necessarily only a skill that you have to utilize when you're out in the wilderness hiking the Appalachian. This is an accident in the kitchen, in your garage, in your workshop, in that hurricane debris cleanup in your backyard and a chainsaw accident gone awry. These things happen, right? None of us are impervious. And it's oftentimes not necessarily yourself that you're training for. It's to respond to those around you.
How long is the class and what exactly does it look like?
So the Stop the Bleed is about an hour, and it starts off with a slideshow and a visual and presentation by myself, walking you through some of the zones of the body and the techniques that we can use and what we're looking for to identify the need for those type of interventions. And then the other half, the back part of the class, is a physical hands-on return demonstration with extremity mannequins that we can practice wound packing and tourniquet application. And so everybody who attends gets a booklet that they can review during the class and to keep for reference, goes through the slideshow portion of it, and then gets to do the hands-on and practice their techniques that they just learned.
And this is actually a national certification.
Yeah, it's actually an international program, but stopthebleed.org, it's a collaborative effort too. It's the American College of Surgeons, the American College of Emergency Physicians, and EMTs, and the the Committee on Combat Tactical Casualty Care. So we pull data and information and resources when to stay with the latest up-to-date information about techniques and how to deploy them. And then we put it out into free educational programs, trying to reach as much of the population as we can.
Bleeding isn't always external blood loss like we think about. Does training help with that as well?
So internal bleeding is a little trickier to identify sometimes, and then a lot of times it's a lot harder to intervene upon when you have just what you left your house with during the day, right? Maybe just my own two hands. So Stop the Bleed specifically is to address uncontrolled external hemorrhage.
Okay. So most people know that they need to call 911 if they witness one of these traumatic injuries that you've mentioned. What are some of the top tips discussed in Stop the Bleed training aside from
Call for help.
So
Call for help is always going to be at the absolute top of the priority list for any type of real emergency, right? Anytime I'm inspired to render care to someone else, the moment that I can recognize their needs outweigh my resources, that's the moment I have to get further help on the way. No, if nobody knows where I am or what I'm doing, no one's coming to help me. So that's pretty much the recommendation for most any type of emergent situation. With bleeding control specifically, it then addresses what do I do for this person while I'm waiting for that help to arrive, whether that's 2 minutes, 4 minutes, 7 minutes. So we talk about techniques to recognize what a life-threatening amount of blood loss might be and how to identify that. And then 3 different types of escalating intensity of bleeding control technique as needed to help our patient.
So what are some of those bleeding control?
There are 3 main techniques discussed in Stop the Bleed, and that's going to be firm direct pressure, wound packing, and then tourniquet application.
As a trauma center, can you talk about how Sarasota Memorial sees outcomes for trauma patients improved by trainings like this one?
Oh, absolutely. So in traumatic injury, we are prioritizing what we refer to as the golden hour. So the first hour after any type of traumatic injury is typically our time period where we have the greatest opportunity to do the most good to help reduce morbidity and mortality for our patients. And in incidents where you have a major injury that you're losing a potentially life-threatening amount of blood loss, at the beginning of the injury, we don't have an hour. We have even less than an hour, right? Sometimes minutes. So seeing these techniques being employed by citizens, by our friends, our neighbors, our family members out in the community to help stabilize that person as much as possible so that we have the opportunity to transport them, get them to the trauma center, and then use more our advanced techniques here at SMH to stabilize them further for that golden hour of opportunity there.
How often are you teaching Stop the Bleed as a course?
Sure. I do a lot of Stop the Bleed education, which is great. We routinely offer Stop the Bleed classes monthly in the Health Connection here at the Sarasota campus and at the Venice campus. So I'm doing at least 2 classes a month between both campuses. But we also do community education events that we have the opportunity to go and teach off-site and come to communities, the clubhouse, your neighborhood, event space. We've taught Stop the Bleed at workshopping class and workshops outside in the community. So I want to teach it to anyone who wants to learn. So we'll take every opportunity we can.
As the trauma injury prevention coordinator, and I know you've told me that Stop the Bleed is one of your most sought after and attended courses. Why is it so encouraging to you to see so many people in our community getting that training and in seeking out the training, whether it's at those community events or at either hospital campus?
So, I mean, it always feels good to have engagement, right, in something that you're putting on and something you believe in. But at the very basic level, I live here. This is my community. My children live here. My family lives here. I want to make sure I can reach as many people who are willing to listen, because when it's me who becomes injured, I hope you know the technique to help me when I'm standing next to you in line and waiting for that. And that's really the impetus, is that it's all about the education. The preparedness for an event like that is knowing, is being exposed to the information of what you should do. And as many people as we can reach, then the more effective it becomes. The greater the chance that those techniques can actually be utilized in the moment that they need to, for the person that they need to be used for.
What's the most common response from people who attend the Stop the Bleed course?
I get a lot of positive feedback from it, which is great, because some of it sounds a little crude when you discuss the actual mechanics of the techniques. So for people who are non-medical or not, exposed to a lot of that, I'm always concerned about putting them off. But there's a lot of aha moments, a lot of positive feedback. I get a lot of people that tell me, like, it makes sense when you say it like that, how that system works and how that would equate to that. But gosh, it really just, being able to put hands on those mannequins and see it in action and feel it and correlate it to what you told me about how that works, that makes sense. I think I can do that. And that's what I'm really going for. You don't have to remember everything I say. I want you to leave with a greater level of confidence that you can do this and do it effectively.
And while it may be while you're out and about, often traumatic injuries happen at home and it's your loved ones you're helping, right?
Yeah.
So do you hear a lot of like, I feel better prepared to help my spouse or my children or
sure,
whatever?
Absolutely. So especially those individuals who take, or their family member, their loved one takes blood thinning medications, right? We all bleed when injured, but if I'm taking blood thinning medications, I have the potential to lose more blood faster, which then it becomes more critically important about how quickly and confidently we deploy those bleeding control techniques. And so I do get a lot of that. A lot of family members are like, I feel better. I feel better that I know this now because it's something that's always in the back of my head. I'm always worried about it because I know that could be a real problem.
If someone's watching this or listening to this and they're interested in getting Stop the Bleed training, I know you mentioned that you do it every month in Health Connection. What other ways can people go about connecting with Stop the Bleed if maybe they're not local or?
Sure. So stopthebleed.org. It does put out, the website can help connect you with a local instructor in your area. There are blended versions of the course where you can do some of it online, the didactic portion, and then find a local provider for the hands-on demonstration. And there's really excellent educational resources on the website altogether, and products and updated all the time. They really are putting a lot of up-to-date information and new resources available. So that would be the best jumping off place. For here locally, if you're interested in attending or maybe organizing a Stop the Bleed class for your local community, then I have them reach out to the Health Connection so that we can see if we have spots for them open in our class, or they'll connect them with me directly.
Awesome. Is there anything else you want to add?
No, I really appreciate you having me on here so that I have a opportunity to talk about this class and share it with everybody, because I am passionate about it. I love it, and I want to see as much of the community who's interested be able to get this training.
Casey Howell, thank you so much for joining us today. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.